Hi, we are Team 15, analyzing Alzheimer's biomarkers through topology. Our research focuses on identifying non-invasive biomarkers for diagnosis of Alzheimer's disease and investigating topological changes in brain networks using both functional and structural MRI data. We obtained brain imaging and clinical data from 203 subjects. Using the AAL Brain Atlas, we generated connectomes from 116 brain regions. Pre-processing involved fMRI prep for imaging data and nylern for connectivity matrices. We extracted topological features and performed clustering. For clinical data, we used recursive feature elimination with a random forest classifier. We also reduced data with PCA and performed agglomerative clustering. Combining topological and clinical data, we conducted consensus clustering to determine final partitions.
We were given many raw fMRI images and T1 images from the Duke and UNC Alzheimer's Disease Center, which we input into a tool called fMRI Prep. fMRI Prep has many different preprocessing steps for structural and functional images. For T1s, we start with making reference images, which are useful for registering functional images to the same anatomical space. Since each patient has unique brain shapes and structures, we use normalization for identifying regions. The next part of fMRI Prep's pipeline is processing functional images. fMRI Prep examines how blood oxygen level dependent signals or bold signals change through different volumes or 3D cross sections of the brain to construct a time series. We use these time series to generate connectivity matrices, which we use later in our data analysis. We correct for the time it takes to acquire slices and volumes. Since patients spend anywhere between 30 to 60 minutes in the scanner, it is possible that they may move their head slightly. In the last step, fMRI Prep applies susceptibility distortion, correction to filter out noise in the bold signals through bandpass filters.
So once we had all our images pre-processed, we were able to extract topological data from it and perform clustering to learn what we can. So this is about the results we got from the topological data. First off, after performing clustering off this data, we ended up having four very nice clusters. These clusters were most likely as clean as they were from a weighting scheme that we had to implement. There was a lot of patients with a normal cognition diagnosis, which made it very difficult for us to consider any other patients. So we added a weighting scheme so that everyone had an equal contribution. And it ended up with the pattern that you can see on both graphs on the right, where as you go along the x-axis, it increases in more severity of the diagnosis with dementia all the way towards the end. However, what we did notice was an unexpected result is that normally the transition is normal cognition to being slightly impaired, mild cognitive issues, and then dementia. However, the impaired cluster was to the left of the normal cognition before going on this normal path. So we're going to investigate this a little bit more and really see why such a issue is being shown.
Let's discuss the results of our clustering analysis on clinical data, which was done in parallel. We selected the 23 most important features and used PCA to reduce them to two principal components for visualization. We then apply agglomerative clustering with 4 clusters, achieving a silhouette score of 0.59, indicating moderate separation between the clusters. Our clustering results closely matched the true diagnosis with a high normalized mutual information score of 0.8 and adjusted RAND index of 0.93, metrics which were used to confirm strong alignment with the actual clinical diagnosis. We did, however, notice an anomaly where MCI cases appeared in an unexpected location on the PCA plot on the right, diverging from the typical progression pattern of cognitive stages. This might be due to our selected features not fully capturing the differences between stages, or it could indicate that some MCI and dementia subgroups have similar profiles, impacting the clustering results. To address these issues, our next step will be to dig deeper into these anomalies to refine and verify our findings.
Our future work contains mainly 4 steps. Our first step is to create a comprehensive framework integrating both structural and functional MRIs to analyze brain biomarkers for early prediction of Alzheimer's disease. Our second step is to develop an advanced statistical method for early detection of neurological disorders using the imaging data. Our third step is to generate a high-resolution spatial regional brain atlas combining both structural and functional data. Our last step, which is also in progress right now, is to combine clinical data with topological analysis using consensus clustering to get a more comprehensive result based on our data. Thank you.